My name is Dr. Sneha Naik Samant and I'm a consultant psychiatrist practicing in Borivali, Mumbai. And today I'm going to answer a few questions about depression and how is it different from normal sadness. Depression is a mood disorder which makes us feel constant sadness and loss of interest in daily activities. It can last for 2 weeks or more. Normal sadness is something which we all feel from time to time due to certain stressful or challenging situations in our life. The thing about normal sadness is that it tends to last for a few hours or days and tends to resolve on its own. The second question is, does depression affect anyone? And what are the risk factors of depression? Yes, depression can affect anyone at any time, be it a child or an elderly. There are various risk factors of depression. The first one is imbalance in neurotransmitters, or simply speaking, chemicals that are responsible for mood regulation. Example, serotonin, dopamine and norepinephrine. The second would be genetics. Studies show that depression is 40% determined by genetics. That means you're more likely to have symptoms of depression if somebody in your family is suffering from depression or any other mood disorder. The third would be certain chronic illnesses like diabetes, multiple sclerosis, cancer, thyroid problems, or sleep disorders. These can also contribute to depression. Next would be female sex hormones. Women are twice more likely to suffer from depression than men. This could be because of changes in the hormone during menstruation, pregnancy, childbirth, or around menopause. The next would be poor nutrition, use of certain substances like alcohol or drugs, and stress. The next question is, does everybody require treatment for depression, and what are the various treatment options? If you are suffering from clinical depression, then yes, some kind of treatment is required. The treatment options are medications, that is antidepressants, or therapy or counseling. The most common is the cognitive behavior therapy. Some patients benefit from the use of a combination of medication as well as therapy. The fourth question is, what do we do if we feel depressed? The first thing to do would be to seek help of a mental health professional, be it a psychiatrist or a psychologist. And if you are reluctant to do so, share your feelings and thoughts with your loved one and ask them to seek help for you. The last question is, how do you help someone who is suffering from depression? The first thing to do is hear them out and then explain them that they are suffering from a medical condition called depression, and this is not a flaw or weakness of their mind, and this can be treated. The next thing is, let them know that you care for them and are willing to support them. And finally, advise them to seek medical help. And if they are hesitant, then offer to accompany them to the doctor's appointment. Hope this was helpful. Thank you.